Chase. I'm here with my co-founder, Bassam Saliba, and what we're going to talk about today is the fact that one of our observations is what we do in healthcare with patients is the equivalent of sending patients to a foreign land and giving them directions in a second language, and then pushing them out the door towards their destination and tell them if they get lost, come on back. So what we really need for patients is the equivalent of GPS, and so that's what we're going to talk about today. As we all know, provider incentives have been flipped on their head. With that comes a whole new set of requirements. And with my experience of having implemented or reviewed over 100 different health IT systems over the years, first as a consultant and then as founder of Microsoft's health platform business, my observation is the core design principle that systems are out there, logically so, are is to get as big a bill out as fast as possible. And patients, in quotes, are really nothing more than a vessel for billing codes. And if you look at a typical provider-centric proprietary patient portal, they really perpetuate the siloization of healthcare, which is not going to solve the issue. And so what we really need is a true two-way communication as opposed to kind of a delayed broadcast that's one way. The key insight, if you talk to organizations that have had the best results in terms of outcomes, is this key insight of who makes the decisions that drive outcomes. Clearly, high severity, the healthcare systems makes most of those decisions, and appropriately so, but 75% of the spend is around chronic disease, and fundamentally the patient or their family is the one who's making the decisions that drive outcomes. And somebody like this gentleman here doesn't want to have 5 different logins to get the information. There's a great point made about the patient being the most important member of the care team. We certainly agree. So to set up the demo, just to describe what Avado is, we describe it as a patient relationship management system that provides patient-centric health professionals with collaborative care tools to deliver care during that other 99+% of their life when they're away from the provider that actually drives outcomes. So there's 2 things we're going to highlight. Number 1 is the ability to have curated patient-specific patient education materials that goes to patients. And secondly is Catherine Sebelius fortunately set up the second part of our demo, the idea of being able to remotely monitor, track patients, send notifications, and whatnot. So let's hop over to the demo. And so one of the key things, just to set it up, we believe that the most important medical instrument is communication. And so the first thing we're going to talk about here is one-to-many communication, and whether it's content that the provider curates. So here's an example of an article that they think would be of interest to COPD patients, or a lot of providers are not in the business of creating content, so we've created an app store, a content app store. And the baseline of this, thanks to Health DataPalooza, is Medline Plus. And so you can target these as narrow or as broad as you want. A lot of the companies before established cohorts of patients, so you can target the patient-specific materials to them. Now let's switch over to talk about tracking, the piece that Secretary Sebelius set up. The nice thing is, with the tracking, you can set up anything that's either standard medical items or custom items like number of wheezing, or how hard it is to walk up the stairs, or increasingly forward-looking providers are buying biometric devices. So we've integrated here with Fitbit, for example, that automatically will pull in that information. And then here you can see how we set up reminders that will trigger those notifications, and we can have that two-way sharing that goes back and forth, so we're not in the dark when the patients are away. And it's a great way to have patient engagement. So let's switch back to the presentation. Oh, actually, before we do that, show you the patient side of it. So what you see here at the top are the patient side of these trackers, so that they've gotten the notifications that you see there on the left. As you scroll down, you'll see this is a multi-provider tool, because nobody goes to one provider their entire life. Scroll down a little further, it's the secure messages, the one-to-one messages, and a bit further is where you see the one-to-many broadcast. So it's sort of a wall, Facebook wallish type of thing there. So let's go ahead and switch back to the presentation. And so the first thing that I wanted to mention is great news for us today, as we announced that a former colleague of some of the folks in the room here Dr. Tom Sang. He was the MD responsible for rolling out Meaningful Use, has joined our team. He helped us design this entry-level product, which we're announcing today, which checks all the patient engagement-related items in stage 2 meaningful use with less than a half hour of implementation time. And the good news there is that's free. We think that's actually the floor for patient engagement. There's a lot of opportunity beyond that, and that's when you get into our full product, which is Avado GPS, which includes the trackers you saw and some other things that we didn't have time to get into. And finally, Avado Integrated is where it's tied more deeply into existing systems or some other custom work. Just to wrap up, Avado, the name was inspired by a village in Italy where people live longer than anywhere else in the world. In fact, men live as long as women there, so we thought that was a great inspiration for our product name and for the Avado community. So with that, thank you for your attention. I appreciate it.
So we'll do some quick responses to from the ACO panel, and then I do want to get to some audience questions. So if we could just have quick responses now, and then let's have a couple minutes. I know we're at 4 o'clock, so if you need to go catch your train or plane, don't be embarrassed. But we're going to keep going while we have some content.
So I think, so patient engagement I think is critically important. So both products I think are fantastic along those lines of trying to get to this space. As a primary care doc, general internist, that's the area that I think we're not good at. We look to our nurses to help us with that, and you know, everyone's overworked. So systems that allow us to do that I think are fantastic. I think the Archimedes product, or it's not the Archimedes, the Indigo product, I think is a really, really interesting sort of approach to start to use data collaboratively with the patient and share decision making that allows people to make better decisions. So conceptually, I think that's moving in the right direction. We need a lot more of that to help people make those kinds of decisions. And I think allowing the patient to do it, allowing the physician to do it, allowing other members of the care team, but then doing that dynamically real time to see what various scenarios will play out to be, I think is a very, very interesting concept. I think in the Avado space too, I think, again, that operationalization with the messaging idea, again, is really, really important. You do sort of say, there's one little flag went up when I was like, ooh, medical legally, is that actually okay? In a separate stream of communications, can we get that integrated? But I'm assuming you guys have thought through all of those issues. So in that sense too, I think leveraging that education, leveraging the ability for our physicians or care team members to think about what we could do in those little moments of time and seize those opportunities, and to be able to do that in a much more scalable fashion, I think is fantastic. So,
yeah, I would also really applaud the patient as partner aspect of both of these products. I think that's so important. And as I mentioned before, I don't think that our EHRs do a great job of that. I love the Archimedes product, or the Indigo product, because it does really distill a lot of very, very complex data into something that's very meaningful for folks on both sides of the computer in the clinic. And I love the Web 2.0 feel of the Avado stuff. I think that again, we fall down in our ability to communicate. My spidey sense was tingling as well around the patient privacy issues. And again, I bring up, my worry is, though our EMRs aren't doing this the way they should be, this is creating a shadow EMR in a different way when we start capturing aspects of the care outside of our gold systems. And I think that what I was kind of hearing alluded to is there is a bit of that potential for that round trip of the data back into the EMR. So that'd be interesting to hear more about at some point.
Yeah, I love the scoring for the patient to be able to see how they're doing and motivate them. Again, there is a blurring of what the EMR's role is versus a lot of the products we're seeing. And if you're a person looking for a solution, just the number of solutions that are out there is a little overwhelming. It's overwhelming to just say that. The other thing is, if some of this is dependent upon the physician having an EMR to use the tool, that's a challenge because in our world, we're hoping to get 50% meaningful use by the end of this year for our ACO. It's not the real world for systems that aren't integrated, so it's lagging.
Great. So we have a microphone in the middle, and if folks have questions for our panelists, please feel free to step up. And you all have trains or planes, I assume.
I think we've said it all, haven't we?
All right. Well, so in the interest of getting you off to your planes and trains, I was going to say something poignant, but I'll just say less. Thank you for staying and focusing. Thank you, panelists. For me, this has been a wonderful education. One thing that resonates both from the audience and from our panelists and even our vendors, they're not evil vendors, they're wonderful vendors, is that we're focused on causing the right things to happen. And it's not about us and making millions of dollars. The vendors that we heard from are, I think, inspired to do the right things, and as a byproduct of that, maybe they make some money, rather than the reverse. So that, for me, that's inspiring. And thank you all for coming, and have a great evening.